Have you heard about alkaline water, alkaline diet? Have you heard that these kind of alkaline water is very good for your body? It prevents all diseases. You will not get sick. You will get better, etc., etc. Your body is acidic. You need this. You need that. Stop right there. Today we are going to clear all these myths. Do you actually believe in all this? If you do, then this video is for you.
अगर आप भी हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करिए मेरा ये चैनल डॉक्टर एजुकेशन और बेल का आइकन दबाइए ताकि आप आने वाले हर वीडियो का नोटिफिकेशन सबसे पहले पाएं।
Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. As you know, I make videos about health and healthcare topics, and all these videos are directly referenced from the internationally accepted US National Medical Library. That's why you can trust this information. Now, today we are going to talk about acidic body, acidosis. There is a lot of myth going around about acidosis, acidic body. People are promoting alkaline diet, alkaline water, and whatnot. So today I'm going to clear this doubt. Today we are going to discuss what exactly means by acidosis. So today we are going to discuss what exactly is acidosis and what does it mean that your body is acidic, and is there actually something like this which happens, and does it actually exist, and if it does, what causes it, what is the treatment, do you actually need all those alkaline supplements or not? So guys, what does it mean by an acidic body? Is there anything like this? Then no. Your body is not acidic or alkaline. Your liver, your kidney, your lungs, none of them can become acidic or alkaline. The only possible thing which can have a little more amount of acid or little more amount of base are your body fluids, your blood, your urine, and other fluids. So acidosis is actually a term in medical field, but acidosis is a condition in which there is too much acid in the body fluids, not in the body, not in the liver, not in the heart, not in the kidneys, not in the brain, not in the lungs. And this acidosis is opposite of alkalosis, where there is too much of base in the body. So why does this happen? What is the basic reason behind this? So guys, first you need to understand the balance, homeostasis, the basic mechanism of chemical balance in your body to maintain this acid and base balance inside these body fluids. There are two organs dedicated for this work in your body. First is your kidneys and second is your lungs. Yes, these two organs maintain the balance of chemicals like acids and base in the body. They maintain the pH, proper pH of your urine, of your blood, of all body fluids. So acidosis can occur when acid builds up or when the most important base in the body, bicarbonate, is lost. So if base is getting lost, acidosis can happen. Acid is getting produced more, acidosis can happen. So acidosis can be of two types. If base is getting lost more, that is called metabolic acidosis. And if acid is getting built up more, that is called respiratory acidosis. This respiratory acidosis is basically because of too much carbon dioxide in the body. Too much carbon dioxide. So this is mostly because of respiratory diseases. If because of any disease, your body, your lungs are not able to remove enough carbon dioxide through breathing, then this can lead to accumulation of carbon dioxide in the blood, leading to respiratory acidosis. This respiratory acidosis is also called as hypercapnic acidosis because carbon dioxide is increased, or sometimes it is just called as carbon dioxide acidosis. Now, why will you have respiratory acidosis? Why would anybody have that? So there has to be some specific reasons. Yes, there are. If you have a chest injury, you're not able to breathe properly. If you have a chest deformity, a kyphosis, scoliosis, your spinal cord is crooked, it's actually pressing against your chest and inside lungs are not able to expand correctly. If your chest muscles are weak, you're not able to breathe. If you actually have a chronic lung disease, a long term, if you actually have a chronic long term lung disease like tuberculosis, COPD, asthma, or acute bronchitis, emphysema, all these things are where your lungs are getting compromised. Sometimes nerves can get compromised, neuromuscular disorders like myasthenia gravis, muscular dystrophy, or even drugs. If you are taking a lot of sedative, sleeping kind of drugs, then that can suppress your respiration and lead to acidosis. But the basic thing here is that the respiratory tract and the respiratory balloons, the alveoli which are present in the lungs, are not able to remove enough carbon dioxide from the blood, leading to carbon dioxide accumulation in the blood, which causes increase in acid, decrease in the pH, acidosis. So this is respiratory acidosis. On the other hand, metabolic acidosis develops when there is too much acid because kidneys are not able to remove enough acid from the body. In this case, it does not happen because of the lung problem, it happens because of the kidney problem, because the kidneys are not able to remove enough acid from the body. And this can be because of many reasons. There can be increased production of acid inside the body. That's why kidneys are overloaded and cannot actually work so much. That's why they're failing. Or the kidney itself might be getting damaged. So let's see what all conditions can lead to metabolic acidosis in your body. Why bicarbonates will get reduced. Why acids will not be able to remove. Why kidneys will not be able to remove the acids. The first and most common is diabetic acidosis. This is also called as diabetic ketoacidosis, DKA. This develops when something called as ketone bodies, which are acidic, are produced and they build up. They build up inside your blood, your urine, during uncontrolled diabetes. Obviously, if there's anything which is very high in blood, also starts coming in urine. So diabetic ketoacidosis causes metabolic acidosis. Second reason is hyperchloremic acidosis. This is caused by loss of too much bicarbonate, sodium bicarbonate from the body, which can happen in diarrhea, severe diarrhea. If you have a lot of loose stools, you can lose a lot of bicarbs, and that's why you can land up into a hyperchloremic acidosis. So this condition also has a reason, and it can lead to metabolic acidosis. Then obviously third thing we have seen, kidney disease. If kidney has a disease, say renal tubular acidosis, proximal or distal, so this kidney dysfunction, kidney disease can lead to metabolic acidosis. Then fourth thing are medicines. Medicines like aspirin, dispirin. Yes, if you take a lot of dispirin poisoning can lead to acidosis because of kidney failure, because of this acid buildup. Ethylene glycol or methanol. These are bad alcohols. Methanols are bad alcohols. Normally, good alcohol is ethanol and methanol is bad. So if you take a bad alcohol, low quality, bad grade alcohol from somewhere, this can lead to acidosis. Then there is one more reason, severe dehydration. If you don't take enough fluid, you're going out in the sun and you're working out a lot, not hydrating yourself, severe dehydration can lead to metabolic acidosis. So all these things are a reason of metabolic acidosis. There is another type of acidosis which is called as lactic acidosis, where a different type of acid, lactic acid, gets built up in the blood. First, you need to understand what is lactic acid and why it is and where it is produced. So lactic acid is mainly produced in the muscle cells and the red blood cells. It is basically produced when your oxygen levels in the blood is low and your body tries to break down carbohydrates to use energy. If there is this kind of a combination in certain areas of the body, in that area lactic acid develops, just like it develops in vigorous exercise. If you exercise a lot, if you run or do long sets of any exercise, heavy exercise or light exercise, your muscle starts paining. That pain is because of lactic acidosis inside that muscle, right? So vigorous exercise for a long time can lead to lactic acidosis because oxygens will be used up. Once the oxygen gets used up and still you are working out that muscle will still try to cut down, try to break down carbohydrates to use for energy, but oxygen is not there. That's why lactic acid will happen. That's why lactic acid will build up. There are many other reasons why lactic acid can be produced in a high amount in certain areas of the body. Like if you have a cancer, if you have liver failure, very low blood sugar, hypoglycemia, if you take certain medicines like salicylates, antiretroviral medicines, metformin, these medicines can have a side effect. Does not always, can have side effects of lactic acidosis in some patients. Then if you have seizure disorder, if you're getting convulsions, if you have prolonged lack of oxygen because of any reason, say you are anemic, blood is less, hemoglobin is less, you have heart failure, you are in shock, or if you are in sepsis, if infection has spread into your blood in the body, then some other reasons like severe asthma can also lead to lactic acidosis as well as respiratory acidosis. Then carbon monoxide poisoning, both things, or drinking too much alcohol can also lead to lactic acidosis. So all these things can actually lead to lactic acidosis. So what are these symptoms? What are the symptoms of metabolic acidosis and respiratory acidosis? So all these things which you've just seen are metabolic acidosis examples, and metabolic acidosis symptoms will depend upon the underlying disease condition. If you have diarrhea, you'll have diarrhea. If you have seizures, you have seizures. If you have alcohol ingestion, if you have sepsis, you can have sepsis. If you have kidney disease, then you'll have decreased urine output. You'll have more deranged kidney functions. You might have dehydration. You might have diabetic acidosis. You might have diabetes. So a lot of symptoms vary depending upon the reason why you are having metabolic acidosis. But metabolic acidosis itself causes rapid breathing. Why? Because a lot of acid is getting developed and rapid breathing will flush out carbon dioxide from your system, decreasing, balancing the acid in the body. So lungs and kidney work in a balance. That's the way they do. If lung is failing, kidneys work faster. If kidneys are failing, lungs work faster. If the balance does not happen, any one of them is severely damaged, then you will fall into severe metabolic acidosis. You can have confusions, you can have lethargy, and in very severe cases, you can even lead to shock and death. So metabolic acidosis is a very serious thing. Same goes for respiratory acidosis, because respiratory acidosis symptoms can also be something like confusions, fatigue, lethargy, shortness of breath, which might be the cause of this acidosis, and sleeplessness. So respiratory acidosis can lead to all these things. Then how do you actually know? How will you know that you are acidotic or not? Your doctor can perform a physical examination, ask you about your symptoms, take a medical history, and then do these tests to actually confirm acidosis. First test is atrial blood gas analysis, ABG. In this blood gas analysis, we get a full analysis of the pH of your blood, how much oxygen is there, how much carbon dioxide, how much bicarbonate, how much lactic acid, how much hemoglobin, sugars, etc., etc. A lot of things are seen just by this atrial blood gas analysis. The second test which we can do is electrolyte test, such as a basic metabolic panel to confirm acidosis and show whether it is metabolic or acidotic, and show whether it is metabolic or respiratory acidosis. So electrolytes can be done, sodium, potassium, calcium, magnesium, etc. Then other tests are done to rule out, to find the cause of acidosis, which can be done like, if you are suspecting a chest problem, you can do a chest X-ray, a CT abdomen, kidney function, liver function, pulmonary function test. So many tests can be done to find out the reason. Diabetic screening can be done. So a lot of things needs to be done to find out why you're having acidosis, respiratory or metabolic. And obviously the treatment will depend upon and obviously the treatment will depend upon the cause. And obviously the treatment will depend upon the cause. Until and unless you know what and why and where this acid is being built up, you cannot treat it. You cannot just depend upon taking anything from outside, alkaline, which will just treat you. No, it can temporarily balance the acidosis, but the problem is still there. If your body is producing more acid or is not able to remove acid, you need to treat that problem. You don't have to add more base in the body. You getting my point? So I hope you understood the concept. And it's not about taking an alkaline diet or alkaline water. It's about diagnosing why your body fluids are having more acids, if they are. First, you need to diagnose if you actually have more acid. If not, then there is no need for anything. And if there is more acid, significant acid in your body, then you have to find out why. Why are they there? Unless you find that, the problem will increase. You might land up into complications. You might have confusion, lethargy. You might land up into severe problems. So that's all about acidosis, which you need to know. And you also need to know, normally people with healthy kidneys and lungs will not have any serious acidosis. If at all they have mild form of acidosis, your kidneys and your lungs are very well capable of taking care of that on their own. So make sure to get tested before taking any medicines or any other product, and talk to your doctor about your own case and get your own answers. So that's all about acidosis today, guys. I hope I have made many myths clear today. And if you are thankful, and then don't just comment, share this video to every single person who has ever told you to take acid, to take alkaline things, or who might believe in these concepts. So you need to educate them like I am educating you. I'm giving you the tools, just do the thing. So next time I'm going to discuss why a body can become alkaline, alkalosis. So till next time, keep watching my videos. I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Super Speciality Hospital. Keep watching, keep sharing, keep commenting. Till next time, stay connected, stay healthy.